My typical patient complains of sinus pain and pressure, facial pain and pressure, postnasal drip, nasal congestion, and oftentimes dental sensitivity. In the patients that suffer from what we call chronic sinusitis, which is an inflammation of the sinus lining, they're the perfect candidates for the balloon sinus dilation.
What is the goal of sinus dilation?
The goal of sinus dilation is to open the natural opening of the sinus, but make it bigger, to allow aeration, which is air moving in and out of the sinus, and ventilation, which is drainage of mucus, so that we don't develop that chronic recurrent infection that we see in patients.
So Dr. Latorre, how do you perform this balloon procedure?
Well, the procedure is performed in the office, and I use a tiny balloon that's inserted into the natural opening of the sinus. My assistant then inflates the balloon, and it will permanently open the sinus to a much larger degree than we started with.
So when you first learned about this procedure, what was it that attracted you to it, to learn how to do it and offer it here at Florida Medical Clinic?
In the beginning, this procedure was performed solely in the operating room. What I found was I had a lot of patients requesting procedures that did not require general anesthesia or a trip to the operating room. And so I moved it out of the operating room into the office, merely because patients wanted a quick procedure, faster recovery time, and something that did not have a lot of discomfort.
So is it considered a day surgery?
It's not even a surgical procedure. I say it's an office procedure where patients will come in on a Friday, let's say, and they'll be back to work on Monday.
So once the procedure's done, the patient has healed, is this a permanent answer to their problems?
This is a permanent answer to their problems. And the one thing I always tell my patients is that 98% of my patients do extremely well with this procedure. There's only a very few percent that require the traditional sinus surgery following this procedure.
Does insurance cover the procedure?
The nice thing about this is it is covered by insurance. The patient's responsibility is typically a copay or a deductible, so it's oftentimes much less expensive compared to the outpatient setting.
If the procedure's done on Friday, how soon can someone exercise afterwards?
I usually tell my patients after the procedure, take the weekend to relax, just don't overdo it. By Monday they can return to work, and I slowly ease them back into their activities depending on what type of activities they like to perform.
How long does the procedure take, and is it uncomfortable at all?
Well, the procedure takes approximately an hour and a half to 2 hours, but that includes total time of getting the patient prepared as far as anesthetizing the nose. The procedure itself is 20 minutes, maybe, and most of my patients feel very minimal discomfort. I won't say that they don't feel some discomfort,
Right.
but they have very minimal discomfort and oftentimes don't require any type of pain medicines after the procedure.
Dr. Latorre, are there any other solutions that you offer here in the office to someone who has sinus problems?
A lot of patients complain of nasal congestion, and I offer a procedure called turbinate reduction. And what I do is there are two pieces of anatomy in the nose that get very swollen, especially during allergy season or maybe in something irritating like cigarette smoke. And what I can do is use several types of technology to actually shrink that permanently. And that gives the patient a much larger nasal airway, and so they can breathe much better. And on a side note, some of the patients do say that their snoring does improve, but I can't guarantee that.
Do you see more patients during allergy season?
Florida is a mecca for allergy and sinus issues, so we see a lot of patients during allergy season. And I think you bring up a good point. We often need to differentiate between the patient that is only an allergic rhinitis patient and one that does suffer from chronic sinus disease, because the balloon procedure is strictly for those patients that do suffer from the chronic form of sinusitis.
I pretty much had sinus problems since I was a little girl. When I was about 5, I had my adenoids removed and the tubes put in my ears. I almost had to repeat pre-K because I was out so much sick, and they thought other things were wrong. I was constantly at the doctor's office, and my whole life I've gotten sinus infections. Being a school teacher and being around germs all the time and already having all of these sinus issues, it's been horrible. You know, I run through all my sick days in the first quarter sometimes, and, you know, you can't do any job properly when you're sick all the time, and, you know, you've got the constant head stuffiness and the constant headaches, and you just feel like, you know, your head's going to kind of pop off from all the pressure and the discomfort all the time. And, you know, I'd be on antibiotics for 1 week, off of them for a week and a half, on them again. It just went on. And it became normalcy. You know, it became something that I just accepted as, well, you know, this is my life, and I'll just have sinus infections and be sick. I had actually been to another ear, nose, and throat a couple of weeks prior that a colleague of mine at work recommended me to, and he only spent like 5 minutes with me. He looked at my nose, he said, well, everything's fine. He gave me some nasal spray, and he sent me on my way. And I just felt like he didn't take time to, I don't know, he just didn't take the time to look at my medical history or to even give me the time of day, really. And so when I came here, Dr. Latorre spent at least an hour with me just for my first consultation visit. He took images of my nose, he looked up there with different instruments, and he was just so gracious and so wonderful, and he went over everything with me. And after he and I both decided that I would be a good candidate for the procedure, then I went in a separate time and got the procedure done in his office. There was a little bit of discomfort, but nothing crazy, nothing excruciating, nothing that you can't handle for a couple minutes. They do it in the office, and the doctor is so calming and so relaxing, and, they give you some sedatives to help you, and local anesthetics and things like that. And it's really just a very calm kind of procedure, and you are awake during the whole thing, but it was fabulous. I can't even put into words really how much it's changed my life. So I would recommend it to absolutely anyone. I never in my life thought that I would be able to just be, free and without all of the illnesses and things that I've had for such a long time. So it has made a world of difference, way, way more than I ever expected.